Eunan, could you tell me why you and Alcohol Action Ireland are in favour of the Public Health Alcohol Bill becoming an act? And could you tell me what the latest news is as regards the progression of the bill through the Oireachtas?
Well, Darren, thanks very much for having the opportunity to talk to you about this today. The bill, the Public Health Alcohol Bill, is a very historic step forward for the public legislators because we, as a nation, have a significant difficulty with alcohol, which, at its current level of consumption, is significantly higher than all global averages. We stand at about twice the global average when it comes to alcohol consumption, and because of that level of alcohol consumption, we have significant difficulties of alcohol-related harms, which results in 3 people dying every day, essentially. It results in about 1,500 beds in our public system being occupied by people with alcohol-related illnesses. We have children who are affected by parental drinking. We have a variety of absenteeism issues. We have a variety of social and economic costs associated with that. And therefore, we think it is extremely important that as a nation that we would address these matters. So, to get to the second part of your question, the bill currently, as it stands, is stalled within the Oireachtas and has been stalled in the Oireachtas since October 2016. October 2015 in terms of, so it's nearly 600 days now since the last time the Oireachtas debated anything to do with the Public Health Alcohol Bill. But we're extremely hopeful. Our new Taoiseach, Mr. Varadkar, has indicated, and as he did in his nomination for government speech, he has given a strong indication that he's very supportive of the measure, and the Minister for Health has equally, in the most recent version of his intentions when the National Cancer Strategy was launched and when the National Drugs Strategy was launched, both have indicated their absolute commitment to the bill. So we think that it's quite likely that the bill will come back into the Oireachtas in the autumn of this year.
Yeah, I heard Leo Varadkar said recently that he wants to see it enacted before the end of the year. To come back to why we need a Public Health Alcohol Act, I agree with you that we need this act, but it would not be fair of me not to put a couple of alternative questions to you on the planned act. What would you say to the argument that we already have a legal age for drinking alcohol in this country, 18 years of age, and that it should solely be a matter for the individual if they drink a lot of alcohol?
Yeah, I think that's very true. I think it's a very clear observation, very true observation. We do live thankfully we live in a free, democratic society where people have individual choices and they can choose to do so. The difficulty is, however, the number of population, or the level of population that is excessively drinking. We're not in the business, for the want of a better word, of prohibition. We're not abstentionism. What we're looking for is moderation. What we're looking for is low risk alcohol consumption. And unfortunately, we have a high proportion of people who excessively drink in this country. Over 1.3 million people excessively drink alcohol, and the costs that are related to that, both social and economic, both through our justice system, our health system, our social welfare system, the costs of those have to be borne by all of society. And therefore it is incumbent on us as a society to act as a responsible society to do something about this corrosive nature that we have with alcohol. And to go back to our earlier discussion, I mean, the Taoiseach makes a very interesting point about denormalising our culture on alcohol. And I think that this bill, were it to be enacted, which has several measures within it, were it to be enacted, I think it would go over time a long way to denormalising alcohol and our relationship with it.
I was reading there last night something just over 50% of people in Ireland who drink who drink excessively, but there's a pretty big difference between the number of men who drink excessively and women who drink excessively, isn't there?
I think there is. Now, off the top of my head, I don't recall the figure, but you're right. I mean, men are a higher proportion of excessive drinkers than women are. I think it's about a 70-30 ratio.
Yeah, what would you say to the argument that the drinks companies provide employment in this country and that the state has no right to curtail their marketing?
Well, the state, again, we do live in a free, open market society. Businesses are in the operation of making a profit, and we're not in the business of trying to stop people from being successful or business from thriving. That's an essential part of our society, and of course it's a fundamental part of society. We need people to have work, we need people to have income, we need corporations to be profitable. However, I mean, the issue isn't about curtailing their particular commerciality. What we're trying to do is what the bill is endeavouring to do is to put in place a set of measures which will have an impact on the alcohol culture that we thrive in right now. So, for example, the minimum unit pricing isn't putting a restriction on the cost, or isn't reintroducing below cost selling. What it's simply doing is putting a floor on which the price of alcohol cannot be sold. Now, what this does, it targets specifically cheap, high alcohol products, which we'd all be familiar with, white cider, some of these sort of high alcohol products. So that's an important measure. That's not a restriction on business. It's merely a block or a measure to try and diminish the purchasing of those particular powers. And the same with advertising, measurements on advertising. There's no restriction or no prohibition on advertising or anything to do with sponsorship or anything of those matters in relation to alcohol products. What there are is a set of measures which would ensure that the content of advertising would change, and it would be limited to a very simple presentation of product. In other words, the alcohol industry would be able to name their product, show their product, describe their product, maybe where the product was made, but it limits the content, and the appeal therefore to young people will be greatly diminished.
Just to finish up talking on the need for a Public Health Alcohol Act, what would you say to the argument, just to talk about minimum pricing again there, the argument that alcohol in Ireland is already expensive and that increasing the price of it is not the way to go and is an extra burden on poor people, on those poor people who don't have a lot of money and they're not abusing it?
Well, there's a couple of things in that. The minimum unit pricing will largely be unwitnessed by most people who drink at a normal, low-risk, moderate consumption of alcohol. The people who will notice it were people who drink cheap, high alcohol content products, because they would see some degree of a rise, and mainly the rise in cost at that level would be on the off trade, not the on trade. So anybody who goes to a bar, a restaurant, a hotel, they won't see any difference in relation to the price of alcohol. People who drink a normal product of alcohol won't see any significant difference in it. But those products that are high content in high alcohol content at a low price, they will see an impact.
All right. So what are the next steps to happen, Eunan, from your Alcohol Action's point of view? And could you tell me, will you be lobbying to strengthen the Act if it comes in future, or will you be happy with what's proposed?
Well, we think that the bill, we envisage that the bill will now re-enter Shannon Éireann in the autumn. It has already gone through 2 stages. It will have 3 stages to go through of the Shannon. There are 52 amendments proposed to the bill, some of which we have been to which we have contributed to. There are other measures to which the opponents of the bill have contributed. They have made some amendments. So I think that the bill, were it to be enacted out of the Shannon or to proceed to Dáil Éireann, probably will have a number of amendments accepted to it or brought to it. I think that those amendments could likely make the bill At some levels weaker, at some levels it may make it stronger, but that remains to be seen, and therefore I can't really speculate on that nature. But we think that the bill, once it comes through Shannon Éireann, will probably proceed then to Dáil Éireann, and if it does proceed to Dáil Éireann, we think it probably will be passed. So I think there's a reasonable chance that this could be enacted by the end of the year.
Yeah, are you going to be out of a job now next year if this bill goes through?
No, I think that there's, if the bill goes through, there's a whole series of processes within the bill. Like, for example, there are issues around structural separation. There are issues around the content of the advertising. Now, some of these issues, some of the measures that are proposed don't have a commencement date attaching to them, or if they do, it'll be a year's time or 2 years' time. So there's a whole series of work that'll have to be done beyond the bill being enacted to put in place all the various elements that'll see the sort of the main 5 pillars of the bill being implemented. And then, of course, when they are implemented, they need to be monitored, they need to be measured, they need to be assessed, and we need to ensure that they're having the impact that we think they would do. But I suppose at another level, I mean, we have got this far with the bill after 5-6 years of intensive lobbying on all sides, and frankly the bill largely doesn't go far enough. So there are a whole range of issues that are outstanding, which would be of a further investigation and renewal campaign for us.
Yeah, I know Leo Varadkar said, I think it was a couple of years ago when he first introduced the bill, that assuming it gets enacted, it'll be reviewed after 3 years, I think. I see Alcohol Action Ireland on YouTube now, and you have some videos from an EU conference on alcohol abuse in Brussels recently. Do you think that it is likely that there will be strong EU regulation brought in to curb alcohol abuse?
I think the answer to that question is largely no. Health is not a core competency for the EU as it stands. There is an ambitious plan by the Estonian presidency, who took over the presidency of the EU just in June, and they have prioritised a single aspect of this, and that is that they want to address some of the cross-border issues relating to health, with some of the alcohol related harms, and specifically health labelling, and they've tried to put that on the top of their agenda, on their health agenda for the presidency. So we think that there may be some progress. But to answer your question more broadly, I mean, there is no overarching alcohol framework for the EU, or indeed any, like the WHO or the UN or any of those issues. So we think that there's limited possibilities. I mean, there are major issues related to all sorts of things in relation to the bill. Like most recently, you've mentioned our EU seminar, which is really trying to address some measures within the Audiovisual Media Services Directive, which is a very singularly limited piece of work for the Joe Soper, for the average punter who would be some distance away from an EU directive. But it's a very important directive, and we've been trying to amend that particular directive to make it more favourable to protecting children in relation to marketing.
Okay, Eunan, it's great talking to you. Do you have a message in summary to our listeners on Near FM about this whole public health alcohol bill and its hopeful progression through the Oireachtas?
I would say the following. We have recently conducted some market research or an opinion poll, and 80 out of that polling that we did, 82% of people were in favour of prohibiting alcohol marketing that appealed to children, and that's a very small part of the bill. But what that poll demonstrated clearly was that the average public were ahead of government in relation to what measures they wanted, because obviously the bill doesn't propose to prohibit advertising, but the public are way ahead of the government in that context. So I would say to people that if you feel strongly about this issue, if you feel there is a need to address our corrosive nature with alcohol and to denormalise it, as the Taoiseach has so eloquently described, that you get onto your local TD, that you get onto your local representatives and ask them, why hasn't this bill been enacted? Why hasn't this legislation progressed? This is a really, really important piece of legislation. It will save people's lives and it'll be highly effective. And the only way we'll get it passed is by ensuring public representatives understand the public's desire for it to happen.
Just a quick question, something you said there. I thought it was proposed in the bill that alcohol advertising on television will be banned before 9 p.m. Is that still the case, is it?
That's an amendment to the bill. It's a government amendment to the bill to introduce a watershed, which is then subsequently proposed to be 9 o'clock. But the bill, actually, the amendment to the bill just allows the minister to make an order in relation to a watershed. The timing is meant to be 9 o'clock. Yeah.
Okay, Ian, it's great talking to you. Next time I talk to you, I hope to be talking to you when the Act has been implemented. It's come in. I'll be talking to Dr. Bobby Smith next week about the proposed Act as well. Thanks very much. Right?
Thank you very much.